All right. Well, we are live on December 28th with Dr. Eric Jauhiainen, our resident COVID nerd expert. And I always appreciate your time and expertise, Dr. Jauhiainen, just to get our community updated on what's going on with COVID, and especially now with Omicron. What have you learned lately about Omicron and how prevalent it is?
Well, it's almost a daily job to kind of keep up to date with this. They did revise some of the prevalent stuff recently. Back on December 4th, the prevalence of Omicron in positive cases was less than 1%, 0.4%. On the 11th, it was 3%. On the 25th, roughly the end of last week, about 58%. The CDC said last week 73%, but then they revised that down. But given that growth rate, within a span of 3 weeks, you go from less than 1% to 58%. You know that it is going to be 75-80% within the next week and a half or so, and then it's going to be 90-95%. It's almost like it's going to blow through. It's so much more contagious than Delta and the earlier variants that you get to a point kind of where you think of it as like a dry forest, and you get a fire and it starts blowing through, and pretty soon all the underbrush is burned up, and there's nowhere else for it to spread. And that's one of the reasons they do backfires in forests to try to prevent spread. Well, in the unvaccinated population in particular, this is it's so contagious. It's going to blow through really fast, and it's going to be 90+% of all COVID, within the next week and a half or so. So it's
this morning I was on a conference call, and the public health lab said that they have up to 50% positivity rate.
Wow.
So that's pretty impressive.
Unbelievable.
And
are these people who were symptomatic?
They just said that just the lab doing the testing, they just, it's either positive or negative, and half of them are, in some cases, are coming out positive.
Wow.
And you talked about our building, doing our preventative fires. I mean, our vaccines are a preventative fire to really prevent spread and prevent severe damage.
Yeah. So the vaccine, and particularly with Omicron, with the booster, because the vaccines were really designed to create antibodies to that spike protein that sits, on the end of on the edge of the virus and attaches to the lung cells. Because the vaccines are designed to get antibodies to that spike protein, there were so many mutations on the spike protein that a lot of the tests that were done didn't even pick up the spike protein, on the Omicron. And that's why the booster is so critical, because the vaccinations that were so effective for many, many months in dealing with the earlier variants like the Beta and the Delta, those antibodies were not nearly as effective in terms of preventing symptomatic illness with Omicron. But the booster decreases the likelihood of symptomatic illness by 75%. And that's just data I've read in the last couple of days. And it's mostly coming from Great Britain. Yeah.
Well, I mean, if Omicron is just exploding all around us, the CDC just made some changes to their isolation quarantine guidelines. Can you summarize that and shed a little light on why that probably is going to work out?
So the earliest reports, particularly coming out of China early on the pandemic, were that the time from exposure to the virus to symptoms was somewhere in the vicinity of 5 to 6 days, kind of on average. And that was true for most of the earlier variants. Then with Delta, which spread more rapidly, you go from down to about 4 days. With Omicron, because as it enters the airways, it multiplies in the large airways way more rapidly than Delta. People get symptomatic much more quickly. So now we're looking at about 3 days. So, and because they get symptomatic more easily, and then looking at, and by the way, people can be contagious and a high degree of contagiousness to spreading to others 1 to 2 days prior to getting symptoms. So it comes on rapidly, the contagiousness 1 to 2 days before you have symptoms, and then the contagiousness in terms of spreading to others diminishes more rapidly too. So that's the estimate now is the peak contagiousness is like from 2 days before you have symptoms up until about 3 days afterward, assuming your symptoms go away. You know, so let's say you're vaccinated previously, and you know, or you got COVID and then you subsequently you got vaccinated, so you do have some immunity. When you get Omicron, and breakthrough infections are exceedingly common, you're more likely to get symptoms much more quickly and for them to decline much more rapidly. So that's the basis for that. The CDC recommendations that just came out are that if you get COVID, you should quarantine for 5 days, and then after that, wear a tight-fitting mask, a good, high-quality, tight-fitting mask, very consistently for the next 5 days after that. As long as, and you can then go out, go shopping, go to work, that kind of thing, as long as you don't have symptoms. If you're symptomatic, you have to maintain the quarantine. My own preference would be that if they said, okay, I got COVID, I'm no longer symptomatic, I quarantined for 5 days, now I'm going to test myself before I go back to work and risk, you know, exposing my people at work or my family. I would probably test for a couple of days and then go, as long as you have tests available. I don't know why they didn't include that as part of it, but out of my love for my coworkers or my family, I'd be testing myself after that 5 days.
Okay. And, you know, there's always been that question from the very beginning with Omicron that it's less severe. And what have you learned about the severity of Omicron?
The early stuff coming out of South Africa were mainly physician reports saying, well, you know, we're seeing people that just don't appear to be as sick, and their symptoms are a little bit different. And then the early studies coming out of Great Britain said, well, we're not so sure about that. Now, finally, just within the past couple of days, there's a good study coming out of Great Britain that showed that, yeah, the likelihood of requiring hospitalization with Omicron is 50 to 70% less than it was with Delta. Now that study was published on the 20th, and I'm assuming we'll be looking at another study tomorrow, and I'll probably shake my head. Oh, you know, shoot, why didn't I have this yesterday? But
you also mentioned earlier, though, you don't have good studies with COVID naive or vaccine naive people.
No.
So we don't know. That's what we don't know is Omicron less dangerous for those people? And we don't know that.
Right. No. So that study that said 50% less, set to 70% less likely to be hospitalized, were in people who were already vaccinated. So these were not a totally naive population. So no, I've looked for it. In a totally naive population, people who have never had COVID before, who haven't been vaccinated, what is the decreased risk? I can't find any studies of that. So, you know, we're waiting for it. It's going to be out there, but I wouldn't take a chance. You know, we know that in South Africa, even though a high percentage of people had already had COVID, in some areas over 70%, yeah, they had this massive spike of, it was like a vertical, increase in cases. And they had an increase in hospitalizations across the country of about 60%. Now, a month and a half into it, they're seeing a big drop in their cases and hospitalizations. So it burned through really quickly. But I don't think you can just be. You can think, oh, I'm going to get Omicron, I'll be immune then after that, and it'll be like a common cold. No, you can die from Omicron. So.
And likewise, you know, we've lost some of our therapeutics. We lost some of the monoclonal antibodies. They don't seem to be effective. But you did have some promising information about remdesivir. What is that? What is this remdesivir, and why is that promising?
Okay, so remdesivir is an intravenous antiviral medication that helps to decrease viral replication. And if you recall that when President Trump got COVID, he got IV remdesivir. Is really best when given early in the course of an illness. So there's a study that was published in the New England Journal of 562 unvaccinated patients starting back in September of 2020 through April 2021. So it was a placebo-controlled trial. So you take half of this group, they got a fake IV. The other half gets 3 days of intravenous remdesivir, and then you wait and you compare the outcomes. Well, the people who got remdesivir early in the course of their illness had an 87% decrease in hospitalization and deaths. So that looks very promising as a therapy. So again, these are people who are relatively high risk people. They were either older than age 60, or they were people with other kinds of problems such as high blood pressure, diabetes, things like that. So it's what I guess I wouldn't want people to do is be sitting at home saying, well, Omicron's a mild disease, and I'm just going to wait. I feel sick, and I did a home test, and I've got COVID, and I'm just going to wait and see if I get sick. If you've got, especially if you've got any risk factors at all, such as age or other diseases, and you get COVID, you should be seeking medical care. Don't sit and wait, a week until you're really short of breath. If the benefit of remdesivir is in decreasing 87% your likelihood, again, this is done mostly with earlier variants, but decreasing the likelihood of being admitted to the hospital is if you get the IV treatment, 3 days of IV treatment as an outpatient early in the course of the illness. You don't want to wait until you're gasping and short of breath and it's too late for you to get the treatment. So
yeah, and I know that Providence will be a depot for that. I don't think it's not quite ubiquitous yet as far as supply, but that's hopefully on its way.
Yeah, well, yeah. Hopefully that's on its way. I would assume that Providence would be the only place you could get that right now.
But we do have vaccines. We have plenty of vaccines lying around. So, boosters, start your primary series.
Now, there's one other optimistic thing here. We don't want to be totally doom and gloom, about this. So I went back and I looked at cases, the number of cases that we had daily on the first day that we had our Omicron case in the state of Washington. That was on December 4th. We were averaging about 1,800 new cases of COVID a day. Now, as of yesterday, we were averaging about 4,000 a day, so more than double. Obviously, it's because of that just dramatically contagious march. But the positive part is, on the 4th, we were averaging about 30 deaths due to COVID in the state daily. As of yesterday, we were down to about 19. So despite the massive increase in cases, we're having fewer deaths. It's still putting a horrible strain on the hospital system, but there's a little glimmer of hope there.
Yeah. Yes. Well, your information gives us some hope as well. I mean, staying informed is helpful for us. And so I appreciate all your expertise and all the energy you put into researching all this. And I know our community really appreciates it as well. So thank you.
Well, thank you, Doctor.
Any last minute words or?
No. Keep your chin up, keep your mask on, and get your booster.
All right. Thank you so much, Dr. Jauhiainen. Appreciate it.
Okay.